For most of us, gauging health involves a daily routine, stepping onto a bathroom scale, and calculating body mass index. It is the standard metric used to determine if a person's weight is healthy. However, millions of people who fall within the recommended BMI range still develop heart failure. This is known in clinical research as the healthy weight paradox. Curious, it raises a difficult question. Why are individuals with a supposedly healthy body weight suffering from significant cardiac dysfunction? This diagram illustrates the limitation of BMI. It calculates total mass relative to height, but it does not account for the distribution of that mass across the body. In this video, we will look at why BMI misses these hidden risks, how belly fat triggers a biological chain reaction that inflames the heart, and the specific tape measure strategies you can use to assess your own risk. Because the scale measures the body as a single unit, it fails to distinguish between harmless weight and the specific fat deposits that actually threaten the heart. Evidence presented at the 2026 American Heart Association Epi Lifestyle Scientific Sessions has begun to change how clinicians predict these risks. Researchers analyzed data from the Jackson Heart Study, tracking nearly 2,000 African American adults over 7 years to monitor heart failure outcomes. The results showed that a high BMI was not a significant indicator of who would eventually develop heart failure during the study period. While the BMI trend line remained flat, the second line, representing waist circumference, showed a direct correlation. Individuals with larger waistlines were at a much higher risk of heart failure. The study also found that waist-to-height ratio, tracked here on the third line, was a more accurate predictor of heart failure than total body weight. The data suggests that for heart health, the location of fat storage is a more critical factor than the total weight a person carries. Visceral fat is the fat stored deep within the abdomen, packed around internal organs. This tissue is biologically active and functions similarly to a toxic organ. This activity leads to systemic inflammation throughout the body. Clinicians monitor this by checking for a blood marker called high-sensitivity C-reactive protein, or hsCRP. This inflammation is the primary driver of the damage. Researchers found that systemic inflammation accounts for 25 to 33% of the link between abdominal fat and heart failure. When this inflammation enters the bloodstream, it disrupts the immune system and begins to damage the walls of the blood vessels. Over several years, this persistent irritation causes the accumulation of stiff scar tissue within the heart muscle, making it difficult for the heart to pump blood effectively. This hidden chemical process, fueled by central adiposity, slowly replaces healthy heart muscle with scar tissue over time. Protecting the heart requires a shift in focus. We have to look past the total number on the scale and pay closer attention to fat distribution and internal inflammation. A practical starting point is using a simple measuring tape. Tracking your waist circumference provides a more meaningful assessment of your heart failure risk than a standard scale. In clinical settings, you can ask for an hsCRP blood test. As noted by lead author Dr. Soo-Han Chen, this helps identify individuals who carry high levels of hidden inflammation despite having a healthy weight. Lifestyle interventions also become more focused. Strategies involving diet, sleep, and stress reduction can be specifically targeted at lowering systemic inflammation to reduce the strain on the heart. To summarize the findings, BMI fails to account for where fat is stored. Belly fat drives roughly a third of heart failure risk through systemic inflammation, which can be monitored via waist measurements and hsCRP tests. Heart disease prevention becomes more precise once we shift our focus from the numbers on the scale to the measurements at the waistline.